What's exciting about this is that the mortality for severe sepsis and septic shock is 40%. We've reduced the mortality to maybe 1 or 2%, and it's just astonishing. This combination of therapy appears to cure severe sepsis and septic shock. And as outrageous as many people may think that statement is, we certainly believe it's the truth. We see it every day, and I think it has the potential to completely revolutionize the way we treat sepsis and septic shock. We think it's extremely safe with really no adverse effects. I strongly believe that until we have that data, that there's enough preliminary data to actually treat patients, because I don't see any downside, and it has the potential to save thousands of lives.
Sepsis is a devastating disease, and over 250,000 patients a year die in the United States, and it's estimated over 8 million worldwide.
Well, very rarely do you see someone who is able to look back in terms of his knowledge many decades ago on the work of vitamin C through Linus Pauling and other researchers, and then have a sort of a brilliant, innovative idea and developed a very simple yet elegant research protocol to be able to apply that to clinical care. And it worked. I mean, who would have thought that someone would be able to give someone intravenous vitamin C and thiamine, which is another vitamin, together with steroids and antibiotics, would have such a difference in the mortality of patients that are suffering from blood poisoning or sepsis.
So what Dr. Merrick has done is taken 3 readily available agents, steroid, glucocorticoid, vitamin C, and thiamine, and put them together in a special combination, and has shown tremendous improvement and reduction in death rates of this very devastating disease.
The accomplishments were quite inspiring. Significant decrease in the length of stay, significant improvement in reducing the mortality of those patients, and with what some would say not highly expensive but very effective pharmaceutical and therapeutic protocols. I mean, we're talking about vitamin supplements here, okay, and not $2,000 a day pharmaceutical regimens.
And we were delighted to confirm his findings. We tried vitamin C alone, nothing happened. We tried hydrocortisone alone, and nothing happened. And we put them together, and it completely restored the barrier function of these cells. I have been working in the field of endothelial cell biology for 30 years, and this is the first time that we see a treatment that works both in the clinic and in the lab.
We thought it had to be a fluke, but then we started having patient after patient after patient that just had these remarkable results. They would be at death's door, and 12 hours later, they would be like 50% better. 24 to 48 hours later, we literally have seen patients walk out of here we did not think would leave.